Good morning and welcome to Hari Cakra Daily News. This is YASINTA PURBO. A COVID-19 crisis has unfolded as the highly transmissible Delta variant shifts through Indonesia, where health facilities have buckled under the pressure. Cases in the fourth most populous nation in the world are soaring, killing doctors and children, and it has become the new coronavirus epicenter, surpassing India despite only having a fraction of its population. On Thursday alone, official figures revealed more than 49,500 new positive cases and 1,449 deaths, the highest since the pandemic began. Indonesian President Joko Widodo has officially extended the country's emergency restriction policy. The decision was taken to ensure that the COVID-19 outbreak remains contained. The current infection and death rates remain far above that seen when cases first began in declining early 2021. In the extended emergency restriction policy period, several small businesses such as traditional food stalls, barbershops, and laundry are allowed to operate until 9 p.m. as opposed to 8 p.m. in the previous emergency restriction policy. Furthermore, dine-in and these small diners are allowed for 30 minutes among other stipulations. But despite government efforts to lock down major islands, the number of deaths continues to grow as grave diggers work through the night, and coffin makers struggle to keep up with demand. So how did Indonesia end up here? The government began its COVID-19 vaccination program on January 13, 2021. This vaccination program is split by 4 phases, with healthcare workers receiving the first batch of vaccines, followed by public servants and then other members of the public. The government targeted a total of more than 208 million people by the end of year 2021. As of August 5th, more than 48 million Indonesians have received their first vaccinations, or 300,000 more than the day before. Meanwhile, 2.2 million people have received their second vaccinations, or 245,000 more than the previous day. Local epidemiologists have repeatedly criticized the Indonesian government for not following advice from experts and scientists. Last year, in the early days of the pandemic, Indonesia's then Health Minister Terawan Agus Putranto attributed the low number of infections to prayer. Indonesian President Joko Widodo promoted traditional herbal remedies and attempted to prevent panic positive narratives without scientific basis. He also proudly touted nationally made anti-malaria drug chloroquine as a second-line defense against the virus, despite a lack of scientific evidence. Last year, the Agriculture Ministry sold antivirus eucalyptus necklaces, which it said would kill the virus if worn for 20 minutes. The claim drew widespread mockery and criticism before being withdrawn. That was today's headline. We are hoping everyone is in good condition and also hoping you have a great day ahead. This is Hari Cakra Daily News. I'm YASINTA PURBO. Have a great day.